Today we're going to be discussing the Solite Pro Ultra Low bed. So the Solite Pro Ultra Low bed is designed to meet the needs of the community and long-term care setting. The Solite Pro bed is designed for patients who've been assessed as risk of falls and require an ultra low bed. Installation staff are responsible for the performing of the initial setup of the bed, including side rail assembly, handset setup, and the setup of any other compatible equipment necessary. The bed frame is intended to support a single user only. A risk assessment must always be performed on the use of any ancillary accessories, including the mattress. The Solite Pro Ultra Low bed is a community, long-term care and domestic electric profiling bed with a maximum safe working load of 195 kilograms or 30.5 stone. This includes any bedding and accessories, including a mattress that is to be used on the bed frame. The maximum user weight will therefore be 160 kilograms or 25 stone. The maximum platform height is 80.3 centimetres. A patented Dual Actuator System allows the Solite Pro Ultra Low bed to be lowered to a minimum platform height of 7.5 centimetres, reducing the risk of falls from height. There is no lower or upper age range specified. It is dependent on patient size in relation to various proportions and gaps within the bed frame. For those patients of a very low weight, typically less than 40 kilograms, with a BMI less than 17 and a physical size less than 146 centimetres, a risk assessment is to be carried out to determine suitability. It is the responsibility of the prescriber to carry out the necessary risk assessments to ensure suitable product compatibility for the environment the bed will be used in and obviously the safety of the patient. The risk assessment should include, but is not limited to, entrapment, falling out of bed, small adults and children, patients who lack capacity, unauthorised people with access to the bed, and the use of side rails and other accessories. Patient conditions for which the use of the Solite Pro Ultra Low bed is a contraindication are cervical and skeletal traction, unstable spinal fractures, especially if the bed remains unlocked, general skeletal fractures, mental capacity, confused, agitated or restless patients, where patients exceed the maximum weight of the bed, patients who are less than 146 centimetres in length, have a BMI of less than 17 and are less than 40 kilograms in weight. Other contraindications may be relevant which are specific to the patient or care environment. Please refer to your local policy and guidance on equipment selection and to the full user manual instructions as a guidance prior to using the product in relation to safe patient use. Before placing the patient onto the bed, ensure there are no obstacles around the bed space that may interfere with bed function or cause an obstruction or trip hazard. Connect the electrical power cable to a nearby socket, ensuring it is not trailing or causing an obstruction. There are 4 independently operated caster brakes. Ensure the brakes are on. It is important to ensure each of the brakes is situated safely parallel to the bed to avoid risk of injury when moving around the bed area. A specially designed mattress is available to be used with the Solite Pro Ultra Low bed, and this mattress must be used if the optional mesh side rails are to be fitted onto the bed. Ensure the mattress is fixed using the retainers on the bed frame and or to the moving parts of the bed frame if the mattress has attachment straps. The bed is manoeuvrable via the aid of the 4 casters, however it is not designed for patient transportation. The bed can be disassembled into 4 separate sections, which can then be assembled onto the transport stand provided with the bed, aiding transportation and safe storage. Always refer to the full user manual for a full list of compatible mattresses. The bed is made of a powder-coated steel frame with profiling sections and a height-adjustable platform. The profiling sections and the platform height are electrically operated and can be adjusted individually via the 9-button handset that you see here. Although the head and the footboard are fixed, they do rise when the bed is being raised. The frame is suitable for patients up to 201 centimetres, which is 6 foot 6 inches in length. However, a manual extension accessory is available, which can be inserted for taller patients, that extends the bed platform by 16.5 centimetres. With the addition of the bed extension, the overall bed platform increases to 218.4 centimetres. The bed platform design also allows for easy attachment of a range of dynamic mattresses. Always attach the mattress straps to the moving parts of the bed frame. An optional pump bracket is available which attaches to the footboard. This ensures that there is minimal movement of the pump regardless of the mattress platform height, and also ensures the pump connector tubing does not become stretched or twisted. The bed is supplied with one handset that can be used by either the carer or the occupant. If the functions are assessed as unsafe for the occupant to use, the handset is supplied with an easy lockout function, enabling the carer to disable them. It is the carer's responsibility to determine that the patient is both mentally and physically capable of operating the handset with minimal risk of personal injury. To lock and unlock a function, turn the handset over and insert the handset key provided into the recess. Turn to the required position, clockwise to lock the handset and anti-clockwise to unlock the handset. A handset lockout light will illuminate green when the handset is unlocked and extinguishes when the handset is locked. The handset has a mains power plug symbol. If this is not illuminated green, the bed is either unplugged or it has a fault. Holding down the relevant button causes the desired function to operate. Releasing the button causes the operation to terminate and all movement will stop. There is a standard 9-button handset which is provided. However, there is an optional 10-button handset which has the addition of Trendelenburg or head down tilt function if this is prescribed. When any profiling function is used, an amber light will illuminate at the top centre of the handset. The bed platform can be raised to meet manual handling needs and support a neutral posture when carrying out any care tasks. By raising the bed frame to a suitable height, the patient may also be assisted to sit and stand independently. Always leave the bed in a lower height position, which is safe for the patient to exit from the bed. It is important to know that when lowering the bed platform will cease lowering at 39.8 centimetres. At this point, you will be required to release the button in order to check around the bed space to ensure there are no obstructions that may interfere with the continuation of the lowering of the platform. Repress the down button again, whereby the bed will then lower at a slower pace and an audible alert will sound until the bed is at its lowest height of 7.5 centimetres. The backrest can be electrically profiled up or down to allow the user to sit up or lie down without the need for manual handling. The backrest will achieve an angle of up to 70.5 degrees. However, the angle of the backrest should be assessed for each patient. Lower backrest angles assist with pressure redistribution and higher angles with respiratory and other clinical needs. The Solite Pro Ultra Low bed also has an auto-regressing backrest. The sections of the profiling bed both raise and regress away from each other at the pivot point of the backrest and the thigh section, closer to the client's natural pivot point, for example, their hip joint. This mimics the way that tissue stretches as the patient moves from a lying to a sitting position, reducing any abdominal compression and shear and friction forces to the skin. When the auto contour button is used, both the backrest and the knee brake functions operate simultaneously. Utilising this function reduces shear and friction forces caused by patients slipping down the bed even when the platform is flattened. The position may also assist to provide a more natural resting environment and promote comfort for the patient. The knee brake will achieve an angle of up to 36 degrees, and this can be used to prevent the user from sliding down the bed as the backrest is raised. A manual calf lift section of 23 degrees is available and is best performed when the bed is unoccupied. Using the handset, adjust the knee brake to its maximum angle. Raise the leg section using the ratchet mechanism. You will hear up to 3 clicks and can then position to the required height. A chair position can be achieved by utilising the auto contour button and then placing the bed into a foot down tilt. The bed can achieve a reverse Trendelenburg or a foot down tilt of 10 degrees. The Trendelenburg or the head down tilt is only available on the 10 button handset, and this should only be used when prescribed. The bed can achieve a head down tilt of 10 degrees. When in tilt, in order to level the bed, again press the opposite direction button and hold until the platform is level. The head down tilt should only be used with medical supervision. The Solite Pro Ultra Low bed comes with a range of dedicated accessories. However, please refer to the user manual for full details. Some of the accessories available are the 10-button handset with the head down tilt function, a bed extension, the dedicated ultra low mattress, the safe mesh side rails, raised height transport stand, a dedicated crash mat, and a pump bracket. The static mattress is made from high specification castellated foam. The mattress also has dedicated blue side formers, which are made from a hard, dense foam that allows for extra stability during ingress and egress of the bed. It has a density of 30 kilograms per cubic metre and a hardness level of 125. The mattress also has a two-way turn. The maximum user weight is 160 kilograms or 25 stone. The mattress is designed for high-risk patients, however, always ensure monitoring and repositioning is carried out as per the individual plan of care. It is the responsibility of the carer to carry out the necessary risk assessment to ensure suitable product compatibility and the safety of the patient. The risk assessment should include, but is not limited to, product combinations such as the bed frame, the mattress, the side rails, extent of tissue damage, if any, entrapment, patient falls, and compatibility of the patient to the mattress size. A lower or upper age limit is not defined, as it depends on the physical size of the patient in relation to the proportions of the mattress and the bed frame. The mattress is intended for single patient use. For those patients of a very low weight, typically less than 40 kilograms, and of physical size less than 146 centimetres, clinical judgment is to be used to determine suitability of the mattress. Always refer to your local policy and guidance on equipment selection and to the full user manual instructions prior to using the mattress in relation to safe use. Ensure the mattress is placed in the mattress retainers. The cover of the mattress is multi-stretch, water resistant and vapor permeable. The 270-degree zip allows the mattress to be examined for auditing purposes. There are high-frequency welded seams which reduce the possibility of fluid ingress and also aid infection control. The mattress has a white inner substrate on the underside of the cover, which helps with auditing procedures by making staining easy to identify if the cover has become compromised. There is also a dedicated infill whereby if the bed has been extended for your taller patients, the infill should be placed at the head end of the bed. There is also a dedicated crash mat. The crash mat is 150 millimeters in depth and folds into a compact square for storage.